Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today we're heading to Texas, a state that's both a leader and a lightning rod in public health conversations. We'll be joined by Representative Nicole Collier, who serves House District 95, representing the Fort Worth area in the Texas legislature. She's an attorney, a longtime advocate for justice, and since 2013 has served as a member of the Texas House Committee on Public Health. Representative Collier has built her career around fairness and access, ensuring every Texan, no matter where they live or who they are, has a fair shot at good health. And she's been unafraid to stand up for what she believes in, even when it means staying on the House floor to stand up to bullies. Today, we'll talk about how she's working to strengthen trust in preventive care, the role of vaccines in protecting communities, and how public health equity can unite people across political lines. Representative Collier, thank you so much for joining us. You've had an incredible career, from practicing law to shaping health policy at the state level. What motivated you to take that leap into public service, and what continues to drive your work in public health specifically?
Well, thank you for having me on, Stephen. Great question. My personal experiences have really directed my path. I don't take anything for granted. My background in terms of health insurance is absolutely vital. I had my first child before I graduated high school. I had two children, actually, by the time I graduated high school, and no health insurance. So I understand the importance of making sure that you have access to affordable quality health care from the start, and making sure that you're able to have a network of providers and services that are local and affordable. I take my experiences just as a person with me, and they help guide my direction, my path, and my vote. And that's what really helps any person that is in this, because they want to improve health outcomes and improve outcomes for the people that they represent. You take those experiences, you use that, you listen to the people, and you're their voice, you're their advocate for the issues that are important. So basically, it was just my personal experiences.
You've said before that your role is to make sure, quote, everyone's voice is heard. When it comes to health, that's especially powerful. How do you make sure that those who are often overlooked, whether it's rural residents, women, people of color, have a seat at the table when decisions are being made?
Here's the thing. I don't wait for an invitation. If it's something that is impacting my community, I'm going to make sure that I'm there. I'm going to pull up my own chair and have a seat to be their voice. So in terms of making sure that I am there and representing, I always think about health in terms of it's nonpartisan. When something comes for you, when you have a health condition, it's not looking to see if it only impacts Libertarian, Democrat, or Republicans, or no party affiliation. It's an equal opportunity impactor. And so when I look at healthcare, I'm looking at ways to address the challenges in the areas that it impacts. So whether it's rural, urban, I'm not looking at it in terms of just one sector. I'm looking across the board. And what we know is that Blacks have poorer health outcomes when it comes down to like COVID, obesity. These things have higher impacts, negative impacts on Blacks and people of color in general. And it has something to do with their circumstances in terms of pay, earning livable wages. It's an access issue. And so we want to make sure that we can try to remove the barriers to make sure that everyone has access regardless. And the data doesn't lie. When it comes down to poorer health outcomes, the Blacks, I'm more impacted.
Yeah, unfortunately, that's so true. And I certainly appreciate that phrase, removing the barriers to access. That's a phrase that we use a lot around here. Also, one of the things we focus on at GHLF is connecting patients to preventive care, including vaccines, screenings, and routine checkups before they get sick. Texas is such a diverse state, enormous differences in access that you were just alluding to. From your perspective, to speak on the positive side, where are we making progress, and where do the biggest gaps remain?
Well, in Texas, we went backwards this last session. I wasn't pleased with a lot of the legislation. I will say my first session, 2013, there was a bill that would opt everyone into vaccines, and you would have to opt out. That's the way we should really approach this. It should be an opt out. But now that you have to opt in, it takes action to require somebody or have somebody get the necessary vaccines to shore up our communities, to protect our communities. But I thought that, in 2013, my first legislative session, I was on public health. I was like, oh, that's brilliant. But then the people who so-called believe in freedom felt like that was too much government, too big government. So something like that was a disappointment. When I walked into it, remember, my mindset is healthcare is something that is nonpartisan. And it just seemed that it was really gravitating towards this freedom, so-called freedom movement. But what about my freedom to be healthy? What about my freedom from your conditions or your beliefs? And so I think that when you're trying to balance it, you got to make sure that you're looking at everything and providing the options. And access is really one of them, and affordability is another. But this last session, they brought in more barriers. They required the Department of State Health and Human Services, I think it's Health and Human Services, to allow people who want to opt out of vaccines to make it easier to do that. That was passed this last session, which is totally opposite from my first session where we wanted to make it easier. So they made it easier for you to ask for a reasonable accommodation for the vaccines this year. So I'm not sure if we're going in the right direction in terms of vaccines, but in terms of diabetes treatment, they're making that type of medicine more affordable. They're taking steps for cancer treatment, dementia. We're doing more investments in that. So that's a great step in the right direction. But we did go backward in some other areas. So it's concerning. It's one of those things that you've got to stay on your toes. You got to stay engaged in the issues to make sure that they're not disenfranchising or harming the communities that I represent.
Let's talk a minute about trust and messaging. We've all seen how misinformation and distrust can affect people's decisions around vaccines. You've spent your career earning the trust of your community. What have you learned about how to rebuild confidence in both the health policy space and also in government itself, which are two areas that are sadly under assault?
I try to make sure that it's all about information, sharing information. I even provide both sides so that way the person can make an informed decision. So it's educating the consumer, the person, so that they know and have the facts so that they can make an informed decision. Even this year, there was some type of notice or warning that were put out for COVID vaccines. They put that it could be harmful. Well, it could be helpful too, but that wasn't part of the warning label. So I think that they're building the distrust into the legislation. And that's very concerning for all of us because it doesn't build trust. It doesn't reinforce the idea or the concept of quality health care. Another thing is that they put out old information. One of the things that we heard during the Public Health Committee was about vaccines that were filled with mercury. Well, that was like in the 1950s. The vaccines have come a long way. Let's talk about current information and data and fact instead of sensationalizing stories that would cause fear and distrust. So I think that we've got to do more. And that means educating legislators, making sure that they have the information. And again, sometimes when they do have the fact, they go with whatever the base is saying.
Sometimes they don't let good facts get in the way of their argument, so to speak. Well, let me ask you this. Sometimes the best messengers aren't scientists or even lawmakers. They're community leaders, pastors, local health workers. What can government officials do? What can elected officials do to empower those voices to promote preventive care?
And whatever committee I'm on, one of the requirements is to contact somebody in my district to get their opinion on the legislation. I want to hear from the community, whether it is a constituent, a stakeholder, an advocate, a hospital. I want to hear from them to find out how this law or the proposed laws would impact the work that they do or them personally. So that is something that is absolutely right. It's staying engaged, contacting your representative or the members of the community, letting them know where you stand, asking them to submit or file legislation on your behalf, telling your story. We don't know everything, and so it is about people giving their input. I'll give you an example when it comes down to, as a legislature, I had breast cancer in 2015. I was diagnosed with breast cancer. And so I was going to go through chemotherapy. From 2016, I went through chemotherapy. Well, on my first treatment, I found out that the drug that the doctor had prescribed was not included in the network. And so I'm sitting here waiting because they mix these drugs up right then and there, and we have to wait for authorization. Now, that is something that it's dumbfounded me. I mean, I just couldn't understand, why do you have to wait in such a critical time for the insurance company to make a decision whether the drug that the doctor had decided, and if the type of cancer I had, it was the only drug. It wasn't like the doctor had a list of drugs that they could pull from. It was the only drug. And so there are people who have the same situation, and we need to be able to hear from them and provide solution. And if it hadn't been for my personal experience, I wouldn't have known that that was happening. So personal experiences and hearing from the community is so important.
How do you talk about prevention and specifically vaccines to your constituents in a way that cuts through the noise and brings people together?
Well, I've had vaccine, not clinics, but where they offer vaccines. I've teamed up with the Texas Medical Association, local healthcare providers to show my support for the vaccines. I remember when COVID was here, wanted to make sure that everybody knew that I was getting the vaccine. So that way they knew. We were hosting town halls to educate people about the importance of getting vaccinated. And so it's just trying to debunk some of the myths and then also give them the facts. And it's also about being part of your community. Having that connection with your community automatically gives you credibility. They know you, they see you, they built that trust.
You've been such a consistent voice for fairness and public health. So before you go, we'd like to ask if you could speak directly to our listeners, many of whom are patients or caregivers themselves. What would you want them to know about how they can help strengthen their trust in preventive care and in vaccines?
Well, ask questions. I would encourage anyone who has doubts or just doesn't know, ask a question to your healthcare provider, wherever you get your information. I know people, sometimes they go to the nail salon, the hair, the barber shop, church. Ask somebody. Even at my church, we have a nurse at the church. That's an actual position at the church. Ask that person. Ask a trusted advisor, someone that you have confidence in, what they think, or if they could steer you in the right direction. And it's important to get that treatment or the help that you need. Once they worrying about the bill later, it's so important. Take care of your health first. The bill will come later. You can think about that later. I always encourage somebody, get that help you need. Don't delay it. There are so many great advances in medicine, regardless of what you think or how bad it is. There are things out there that we may not know about, that you may not know about, that there are people who are studying and they may have options for you. Always exhaust all options. Don't take no for an answer and just keep asking around.
Representative Collier, thank you so much for your leadership, your persistence, and for reminding us that health equity and prevention are not partisan, they're human.
Absolutely. Thank you so much for having me, Stephen.
That was Representative Nicole Collier, a powerful advocate for fairness, public health, and the idea that prevention is a shared responsibility. If you'd like to learn more about our vaccine advocacy work, including our state-level outreach and how we're building trust through education, visit ghlf.org/vaccines. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.